The Pan-London Care Leavers Compact is made up of key themes which outline the challenges care leavers face, whilst exhibiting ways in which the local authority and the regional government could make improvements. I will be conducting short interviews with professionals in order to identify what has been done and what is going to be done for the Care Leavers Compact.
I'm Kath Evans and I'm a children's nurse by background. My main job is that I'm Director of Children's Nursing at Barts Health, but I also work across the NHS in our integrated care system. I also work at NHS England London region.
My name is Ruby Sayed and I'm an elected member for the City of London. I represent the ward of Farringdon Without, and I'm also Chair of Communities and Children's Services, and I'm Chair and Lead Member for Safeguarding for the City of London. For my day job, I am a barrister at One Pump Court Chambers, and I specialise in family law, and particularly children and public law proceedings.
I'm Jackie McShannon. I'm the Strategic Director of Children's Services in Hammersmith and Fulham. And I'm also one of the co-London leads for the Pan-London Care Leavers Compact.
My name is Prash Sophie Nathan. I am the head of Lambeth Virtual School for looking after children and care leavers.
What is the Care Leavers Compact and what are we trying to do?
The compact is about helping to make London an even greater place for care leavers. London has so much opportunity to offer, and yet the outcomes for care leavers are still not good enough.
We are working together across all partners to develop a good offer for care leavers. It supports all aspects of care leavers' life, so not just education, employment, training, but health, housing, finance.
The Care Leavers Compact gives us an opportunity to make sure that health plays its part in better supporting care experience to young people. So we've been particularly focusing on areas such as access to mental health support, access to prescription medications, but we know that we've got so much more to do. So I think it's really, really important that health works alongside local authority colleagues to really make sure that we are playing our role as parents.
We all work together and we share our experiences and share our achievements. I think that would make a much greater difference, but also raise awareness.
Why is it so important and why do care leavers need it more than young Londoners?
Currently, the outcomes for care leavers are not as good as they could be. What we need is a platform where we all can work together to share our knowledge, our resources, our understanding, so that we can build a best practice across London.
As a care leaver myself, I have a real understanding of the challenges that care leavers face, and it's important that we ensure that care leavers are supported and ensuring that they have all the same opportunities as any other young person, and it shouldn't be a postcode lottery.
So I've talked to care experienced young people. They've shared with me some of their life experiences. It feels as though for me, we need to be doing everything we possibly can to provide better support. Now, whether that means children who are already in care get the mental health support that they need before becoming care leavers, or whether it means making sure that our young people who have been in care, who are now perhaps living independently, earning slightly above the income cut-off that allows people to have free prescriptions, still have access to prescriptions. So I think there's something in all of us, whether it be the NHS, whether it be local authorities, to actually make sure that we're providing that wraparound, ongoing support, particularly for our care experienced young people.
Sadly, the data shows the stark needs of some of our young care leavers who are 4 times as likely to not be in education, training and employment. And that's a sad and it's a very stark statistics. And it really behoves us to do more. So taking a proactive approach that acknowledges the inequity is really the way forward. Young people who are care experienced don't just have the same needs as other young people. They really need more input and support to help them tackle that disadvantage and to help them realise their potential.
Why should we work collaboratively with care leavers?
It's critical that we have care experienced young people that are able to share their experiences, able to share what works well for them, what doesn't work well for them, and so that we can co-design a offer that is contributed heavily from care leavers, so that we can hold ourselves to account for what we are delivering.
Who is involved and why?
The Association of London Directors of Children's Services is leading on the framework, championing young people's rights and needs with the compact. But actually, we've got lots of different strategic stakeholders involved, including health, businesses, local authorities, and the voluntary sector, who are very much leading the way. Transport for London, Greater London Authority, the housing sector, among others.
So in each of our integrated care systems across London, and we've got 5, we've got children's champions who perhaps come from a medical background, from a nursing background, from an allied health professional background, who really want to do better. And we're all collaborating. So all of us have worked across London to make sure that there's going to be a consistent offer for all care experienced young people.
We've got a lot of strategic groups involved, for example, businesses in offering careers advice and guidance, work experience and jobs. And there have already been some achievements. We've secured 50% of trams and buses from Transport to London. Health have agreed to free prescriptions for eligible care leavers.
What do we want people to do and how would they get involved?
So I know that our local authorities have got children in care councils. I think NHS colleagues need to be connecting up and having conversations and hearing from young people directly about their experiences of accessing services, what's worked, but importantly, what we can do better, and also have conversations about job opportunities as well. The NHS is one of the biggest employers in the whole of the country. What more can we do to actually create pathways to employment?
We know that young people are very different, they have diverse needs, and actually we want to have an offer that meets that diversity and meets young people and their interests and their aspirations. We are ambitious, we are aspirational, we want to work collaboratively to make sure that we use all of London's assets as community parents.
The way to go about it is to make sure that we're putting enough challenge and pressure across all systems, in a sense that everyone is thinking about what's happening as a parent and being less corporate. That's the best way for us to make change. And it needs to be more than just local authorities doing this. This needs to be a wide range of organisations involved.
I am vividly aware of the challenges that I faced growing up. Care leavers generally underperform when it comes to education, when it comes to access to opportunities, careers. All of us collectively have a responsibility to start supporting our care experienced young people to break those barriers and to enable them to reach their full potential.
We can't accept the status quo. We know that we have to step up and we have to do better.